This is The Micro Effect. The Micro Effect. www.themicroeffect.com.
You take the blue pill. The story ends. You wake up in your bed and believe whatever you want to believe. You take the red pill. You stay in Wonderland. And I show you how deep the rabbit hole goes.
There was a mighty nation, blessed above all of creation. It was a rare and precious pearl, conceived in faith and liberty, home of the brave, land of the free. It was the envy of the world. But this shining city on a hill has turned from the Creator's will and let evil take control. Now the reckless men who lead them want to strip away their freedom and to steal their very soul. Now it's smoke and mirrors, switching bait, criticize and confiscate and let the guilty walk away. In this once righteous, godly nation, in the halls of education, they forbid a child to pray. They say we need to spread the wealth. They pretend to guard the health of the feeble and the poor, while the hand they hold behind their backs confuses and conceals the fact that the wolf is at the door. There's an unseen hand that pulls the string. It makes his little puppets dance to every song.
It's May 8th, and welcome to Connecting the Dots with Dan Happel. And this morning we've got a great program scheduled. We've got a guest online who is one of the top experts in the medical profession in our nation, and she will be talking about just exactly how our system of medicine has been changed over the last 8 years and why we need to get free enterprise back into the system. Our guest today is Jane Orient, and Jane is her credentials are, and I'll use this because she's quite a lady. Jane is Executive Director of the Association of American Physicians and Surgeons, and she is also the President of Doctors for Disaster Preparedness. And we really feel like we have quite an honor here having her on our show. And we will dissect what has happened with our medical system over the last, let's say 40 years in reality, but especially since the advent of Obamacare. So with that, Jane, welcome to the show, and thank you for being our guest today.
Well, thank you. It's great to be with you, and I really appreciate what you said. It's been at least 40 years. 8 years have made things far worse, but the real problem began quite a long time ago.
Yes, it's been happening really since the government got involved in the medical field, and that happened with Lyndon Johnson and Richard Nixon. And all I can say is that every time the government touches anything, it usually ends up doing the exact opposite of what it says it's going to do. Instead of reducing cost and providing more services, it goes the opposite direction. So with that, Jane, would you tell our listeners a little bit more about your background and your profession and some of the things that you've been involved with?
Well, I practice medicine as a general internist. I've been in solo private practice since about 1981, and before that, I was a VA doctor for about 5 years, where I developed this horror of having everything become like the VA, which is VA is our version of socialized medicine. The government owns everything and really dictates what doctors can and can't do. So I have been very, very concerned about this movement that's been going on for a long time to expand government control over every aspect of medicine. And I think the motive for that is it helps the government to expand its control over the whole population. If it has your access to medical care for relief of pain or to stave off premature death and so on, then really it has a big club to making sure that you stay in line and don't resist what the government wants to do. So all this stuff about compassion, it's not about improving access, it's not about improving quality, it's certainly not about improving or lowering costs. It's about increasing government control.
Yes, you're absolutely right. That stands out above all other things. Whenever the government gets involved in any aspect of our lives, we lose a lot of our own personal control of our lives, and that's certainly the case with health care. Would you let's open the discussion with a look at the fundamental differences between free market health care and socialized medicine. Please tell our listeners what the pros and cons of each approach to health care really are.
Well, there are no pros, in my opinion, to slavery. It's only cons. The differences between free market medical care and government-controlled and funded medical care has to do with freedom and about really who the physician is working for. If you are paying your doctor, then the doctor is working for you, and he is supposed to have your best interest at heart. The safeguard against overutilization and all kinds of bad things is that the patient is the one who is in control of the money and in control of the decision-making. With government-controlled medicine, or with third-party controlled medicine, and third parties, of course, are heavily regulated by the government. That means anybody else is paying the bill, the insurance company, and so on. Then the doctor gets his paycheck from the insurer, from the third party. And he gets paid on the basis of what's on the claims form, what codes there are. It doesn't really matter whether he cared about your best interest or just cared about getting quality points from the insurer. And so you really have to understand that your doctor is in a conflict of interest. Now, it used to be with insurance, and as it still is with other kinds of insurance, is that the insurance company is there to reimburse the subscriber for a catastrophic financial loss. Like you totaled your car, the insurer will send you a check based on the terms of your contract and the amount of damage that was done. But with so-called health insurance, the insurance company, particularly the managed care companies, have taken over to a large extent the actual delivery of the service. And they pay whomever they like, however much they feel is desired, and you have increasingly limited choices about what sort of care you can get.
Okay, and with that, with those limitations, and that's one of the areas we'll get into in quite a bit of detail today. Something that happened with Obamacare, first of all, is that there were certain assurances and guarantees that President Obama and really Hillary Clinton before him used to promote a nationalized health care system. And that was that it would be available to everyone and it would be available at reduced cost. Obviously, this fails to meet the smell test. As it was finally adopted, it's done the exact opposite in every regard. Tell us why the system is so much more expensive and why the availability is going down, literally, to everyone.
Well, first you need to understand what the Obamacare plan actually does, and I read the whole mess, a couple thousand pages of it. But you really can get the whole picture from about the first 10 or 12 pages, that what it does is it outlaws medical insurance, it outlaws sickness insurance, it outlaws true insurance, which reimburses the subscriber, not the provider, for a catastrophic financial loss. And that means that instead, it's like a health plan. It's a managed care health plan that promises to give you all necessary medical care. But they're the ones who define what all necessary medical care is. And it inevitably is going to increase the cost because it gets rid of the free market regulatory mechanism for costs, which is people spending their own money. You can't even find out what the price of anything is. Honest price signals are just obliterated. And then the other thing is it covers all kinds of things that a real insurance plan wouldn't cover because they're predictable. So if you're going to get your money's worth out of this very, very expensive plan, you have to use all kinds of things you would otherwise decide were not worth it. And furthermore, it increases the cost of providing the services because there is so much regulatory overhead, so much reporting requirements, so many compliance requirements that when you go to the doctor's office, you probably see that there may be one or two doctors, but there are probably about 5 ancillary staff for every person, doctor or nurse, anybody who actually lays hands on the patient. They have all these people in the business office dealing with the third-party payer.
Okay, that makes perfect sense. Well, it makes perfect sense why it's so expensive and some of the limitations. One of the things that was revealed through public records is that the architects of Obamacare intended that it was only the first major step to provide a single payer socialized medicine, which was the real end game. Maybe explain how this process works and how with Obamacare we've moved that much closer to a single payer system that would literally take all of our options off the table other than socialized medicine.
I think that some of the architects are pretty candid about this, that this was designed to fail. It puts impossible requirements on insurance companies. They just really cannot afford to provide all these benefits to people without being able to charge any payments to any charges to the patient at the time of service, with inability to price premiums according to the risk that they're going to have to pay out a claim. That insurance companies absolutely cannot make a profit or even break even under the system, and the only reason they are still there is because of huge taxpayer subsidies. This promise that everybody will have access to health care really means that the government promises that somebody else is going to pay your medical bill. Everybody really has access to medical care now. It's just that they can expect to get a bill. And the real promise of Obamacare is, well, these facilities that provide care is still going to be there, but the taxpayer is going to pay the bill, or somebody else is going to pay the bill. Like the people who get subsidies for their insurance, the people who have to pay their own load are having to pay a lot more in premiums than they otherwise would.
Okay, well, I understand how that works. One of the things that also came out of this same discussion, and again, it was kind of the the workings behind the scenes, were that the architects actually realized that they couldn't possibly cover everyone as stated, not over the long term, and the concept of death panels and exclusions for certain people, so-called high-risk people or people over the age of 75 years, was ultimately to be part of that program. Tell our listeners why, in fact, the medical professions are resistant to this kind of thinking.
Unfortunately, it's not resistant enough because a lot of physicians have gotten accustomed to getting this paycheck from the third party without having to explain to the patient why they're doing all these things that cost so much and that may not benefit them very much. But the big evil in the big lie, the biggest lie behind all of this is promising people universal health care, when from the very start it is a universal rationing program. That just try calling up the doctor, to get an appointment, and they ask, well, what plan are you on? And with the Obamacare plans, they are having increasingly narrow networks. So you have only a very small range of choices of physicians or hospitals, and a lot of people have lost their insurance 3 or 4 times already under Obamacare, and every time they lose their insurance, they may lose the doctor that they trusted who was taking care of them, or the hospital that they went to because they had the best treatment facilities for whatever they had, and those have been now not in the network of the new plans. So it's very disruptive to ongoing treatment, and it also limits the choices for starting new treatments. And this is really deliberate. They're deciding what has value, and that means value to the system for improving their population health matters. It truly is about population health. That's what medical ethics is even becoming about, which means that's not your health. If you're not healthy to begin with, and there's nothing that can be done to get you over your chronic illness, you are a liability. The system is designed to cut off, ration, restrict your care.
Well, and that actually makes sense when you think of how the New World Order, the globalists, the humans on Earth as being more liability. They don't appreciate the intellect and the great things that humans have been able to accomplish. They see, I think a lot of them see humans as being like ants. They're just they're there, and the fewer of us that there are, the better off the world would be. And that's a real direct contradiction to the Hippocratic Oath, and a real direct contradiction to what medical doctors, at least all the medical doctors that I've actually worked with, what they feel about human life. Where did this globalist idea come from in the first place, Jane? Can you tell our listeners what your feelings are on that?
Well, I don't know where it comes from, but certainly world government's been talked about since I was in high school, and I'm sure it was well developed at that time, so it's been around for long before that. I think there are a group of people who really think they're smarter than the rest of us, and it's not that it's some conspiracy of people meeting behind closed doors somewhere. A lot of them are quite out in the open about it. You can find in the open literature people, the supposed do-gooders, who truly want to reduce the world population by several billion. I mean, they may think that a few 100,000 people is all that the planet needs, and that the 10 billion that are projected to be there are just like a plague on our fragile planet. I guess maybe it wouldn't necessarily be better for the Earth to be a sterile rock hurtling through space, but you know, a rock that had very limited reservations for human beings they might find is desirable, and then of course there will be the elite that can control all of these humans that exist to just serve the needs of the elite.
Right. No, you're absolutely on top of that, and what it boils down to is that many of these people that are at the highest pinnacles of government and really control the process are the same people who see Christianity or religion as being some sort of a negative thing, and that they're relative humanists, and they believe that the human condition is something that can be controlled, and it can be something that has really no spiritual value. And I think that's probably what's behind a lot of this. You mentioned the reduction in population. I know they've actually published papers that say the human population needs to be reduced to fewer than 1 billion people to have a sustainable world. And boy, that's a huge reduction. That's 93% reduction in human population. So certainly if you manipulate the medical system you can accomplish at least part of those goals. Is that kind of your feeling too?
Oh, I think so. And these people may call themselves secular humanists, but they have such an anti-human attitude, at least anti-human for all of those deplorables out there, that calling themselves humanists is just not accurate. And secular, they really have a religious type of devotion to these supposed environmental causes, where the environment or the earth is maybe like Gaia. It's kind of like an organic, godlike person, and I don't think that you need to do much speculation to find out that religion is a threat, because it's an alternate authority to them. The family is also a threat. They really want to get rid of the traditional family, or really any type of institution that competes with them for being the deciding authority that people have faith in, and that could overrule them.
Right. That's and your comment about these people talking about humanity and then doing the exact opposite. There's a saying that I absolutely love, is that socialists or progressives love humanity. They just hate humans. And that, boy, if that doesn't sum it up in a nutshell, I don't know what does.
I'm not sure they love humanity either.
Well, that's probably true, but that's what they profess anyway. I'd like you to maybe explain how medical centers like the Surgical Center of Oklahoma and other free market healthcare providers have come up with much higher quality health care for a fraction of the cost of the so-called public-private partnerships and government-mandated programs. These places are in existence, and they are springing up, and it's amazing how much better the quality of health care is at these kind of facilities. Are you familiar with this group, and can you give us some insight into this?
Yes. We certainly are very well acquainted with Keith Smith, the anesthesiologist who founded the Surgery Center of Oklahoma. He's been a longtime member of the Association of American Physicians and Surgeons, and he did this truly revolutionary thing. He decided to post prices on the Internet, package prices, cash prices on the Internet for all the things that they do at this surgery center. It's an ambulatory center. It does not take third-party payments. It has no managed care contracts. It does not take Medicare. It will treat Medicare patients, but only as cash-based patients, and I think the patient actually has to be not in Medicare Part B, because they are not willing to abide by all of the Medicare restrictions. They came up with their prices by asking the surgeons, well, what would you really like to get for doing this procedure? Would it make you happy to see the patient? They knew the cost of all the materials. They knew the cost of the operating room and that sort of thing. So they came up with the price, put it on the Internet. It turns out that some of those prices are as little as 1/10 of what Medicaid pays for these hospitals. And, of course, the hospitals are crying poor, even the nonprofit ones. But the fact is that most of the money that you pay to them, probably at least half or a third or even more of the money that you pay them, goes to something that has absolutely nothing to do with the people who are taking care of you. It doesn't pay the doctor. It doesn't pay the person who empties the trash. It doesn't pay the ward clerk. It doesn't pay the person who answers the call button. It all goes to people in the administrative wing or other folks out there who are not contributing anything. And it's only possible to see the amount of parasites that are involved in the system and the amount of deals and corruption and behind the things, when you can see that somebody can do this same work for a fraction of the price. I've been to the Surgery Center of Oklahoma. Their website is surgerycenterok.com. It's a beautiful place. It runs very efficiently. Every good surgeon in Oklahoma City wants to be on this staff. There is very little staff turnover, and the patients, once they've been there, they want to come back again if they ever have to have another surgery.
Well, and something else that stands out is the fact that the infection rate at the Surgical Center of Oklahoma, although in many hospitals it's anywhere from 4 to 10%, where people who are patients pick up these horrible infections that are very difficult to try to get rid of. They're virtually non-existent at the Oklahoma facility. Obviously, the quality of the healthcare is outstanding.
The quality is excellent. Dr. Smith thinks one thing that helps them is they have very large operating rooms, so there's less concentration of germs. Also, the place is immaculately clean. In many hospitals you go to, the place is filthy. The floors are filthy. The trash is overflowing. It's really not surprising that there's so much infection.
Yeah, that's right. Well, let's, we talked about early on, and I'd like to, I know you've got a lot of insight into this, but the fact that the second that healthcare started having government controls over it via the Medicare and Medicaid system, the cost started to just skyrocket. And it's gone nowhere but up. I remember my daughter, who is now 47 years old, when she was born, it cost $500 to have her, to have her born. I guess that's the best way to say it. And for the medical care, and that included the hospital bill, and that included the doctor. Now, by my understanding, and this is something that my youngest grandchild is now 8 years old, seven and a half years old, and it cost like almost $30,000 to have him go through the same process. That all happened because of Medicare and Medicaid and the cost of government-funded health care. Can you kind of explain? You already did in a way, but the fact is it's all the bureaucrats and all the people in between who are making this process extremely expensive.
I think, and there's also all of these huge building projects. There's an old book called The Hospital That Ate Chicago. The good facilities are torn down and much more elaborate ones are built up, all with borrowed money, which comes about because the facilities have kind of a guaranteed revenue stream from the government. But in fact, when Medicare went into effect, doctors who were practicing then say they saw the hospital...
Jane, I hate to break this up, but we have a break coming up. Can you hold that thought till the other side of the break, please?
Oh, okay.
This is The Micro Effect. The Micro Effect. www.themicroeffect.com.
And we are, as a people, inherently and historically opposed to secret societies, to secret oaths, and to secret proceedings. For we are opposed around the world by a monolithic and ruthless conspiracy that relies primarily on covert means for expanding its sphere of influence.
It was 1776 when the founders signed the writ of independence from the Brits.
Well, welcome back to Connecting the Dots with Dan Happel, and today we have a very special guest on our show, Dr. Jane Orient. And Jane was discussing, and when we left for the break, how Obamacare, we've kind of discussed how all these programs are tied together and how the cost is increased as a result and the quality of health care has gone down. Before we get back into that discussion, I want to remind our listeners to tune in for Jeff Bennett's radio program after my show. That's Life, Liberty, and all that jazz. And Jeff does a terrific program on radio after our morning show here, and also follows up behind Debbie Boscalupi's Radioactive Wednesday. Debbie's got a terrific program on at the same time as my show, only on Wednesdays, and she is doing a fantastic job of exposing the creatures behind the New World Order. So please tune in for those radio shows. And also, I ask our listeners to continue to support and maybe consider increasing your support for this radio network. We are in the process of acquiring a satellite uplink that will allow us to reach millions and millions of listeners, and we're very close to reaching our goal. We need your help. We need to make sure that we get the money to make this happen. So with that, please support this network and support our radio programs. Jane, I'm sorry I had to cut in. Would you finish your thought? And then it sounds like we have a couple of other guests on the show. Paul Driessen is on, and of course you know Paul very well. And a friend of mine from the Kalispell area, Dr. Annie Bukacek, is on the call as well. And Annie is a very pro-life medical doctor. She's a general practitioner from the area, but she has worked very, very hard in Montana to protect the lives of the unborn, and she is just a fantastic lady. So I will welcome her to the show as well. But Jane, would you finish your thoughts, please? And then we can start a discussion on what is behind some of this stuff.
Well, I was saying that some of my colleagues who were in practice at the time that Medicare went into effect found that the hospital bills were doubling or tripling practically overnight. And I think part of the reason they went up was because they could. The hospitals could get paid for things they used to do for free. The other thing is that they took upon themselves completely reconstructing a lot of hospitals. When I was a medical student, we had like the ward service where we had maybe 12 patients in a ward, which wasn't terrific for privacy, but the nurse could see from the nursing station everything. It was much more efficient. And then they broke them all up into rooms which may have had 2 or 4 people, which also are not that great for privacy, but are take a lot more work to go to every room, and a lot of things can go on in the room that you can't see until it's really too late to do anything about it. But the hospitals undertook a lot of expensive construction projects that they didn't do before, and then they started doing a whole lot more procedures they would get paid for, even though they probably made very, very little difference to the patient's final outcome.
Well, I noticed that the technology has had a huge impact on the medical profession, and things like MRI, CT, various quite expensive technologies have come into play, and they've used that as a rationale for the huge increase in medical costs. But in reality, these new technologies make surgery so much more practical and have led to advances in medicine that I would think would really reduce the cost of medicine and make it that much better and that much simpler to provide good health care. Do you disagree with that? And maybe I'd like to hear your opinion on that technology.
Oh, the technology is wonderful, but in every other field, technology brings prices down, and somehow it doesn't in medicine, and that's because with a third-party payment, you can get away with charging a whole lot more than you otherwise could. If you do have a free market, like you do in places that don't have certificate of need laws and things like that, you may find that you can get an excellent MRI or CT scan for 1/10 of what the hospital is charging you for it. And why is that? Why can the hospital get away with charging so much more?
Right.
And it
right.
There is some overutilization because nobody's paying for it, and doctors may get paid for doing the CT scan, but they don't get paid for talking to the patient, so they may just ship the patient off for a CT scan. And I can tell you that the result of not talking to or examining the patient is very, very bad for clinical outcomes. Relying too much on the technology, doctors are missing timely diagnoses that they could have made much more quickly than they do now.
Well, that makes sense, and the part that really doesn't make sense to me, though, is the fact that now we provide all this free health care for illegal aliens and other people who say they can't afford health care that go to emergency rooms. And I know there's a mandate there to protect human life, and I certainly am not opposed to that. But I know that many of the hospitals in California right now are literally on the verge of being shut down, and the primary reason for that is that they're treating all these non-paying patients, and that's got to be a huge strain on the system as well.
A huge number of emergency rooms throughout the country have already shut down because people just come in and don't pay. And the government is saying, well, everybody deserves treatment, but they do not pay for it through taxes. They just expect the private sector, even without a legislative tax, to just absorb all of this extra expense. I can tell you maybe doctors have to work a lot without being paid, but the other folks at the hospital do not go to work if they do not get paid.
Okay. Well, I guess what I want to ask you, and this is something that you could probably have at least an opinion on, is why our elected officials, even most of them, ran on the fact that they were going to repeal Obamacare, and once they were elected or reelected, and President Trump certainly wanted to repeal Obamacare as part of his platform. And now that these people are in office, and we do have a clear majority of Republicans in the House, the Senate, and also as president, why in the world haven't we repealed this lousy legislation?
Well, I think you're assuming that politicians tell the truth. We're now on the campaign trail. Actually, they say what people want to hear. Once they get in office, most of them are only wanting to get reelected. And they recognize that the most important people in their lives are the donors. And the donor class and the special interest groups and the lobbyists do not have the same interests as the people who vote. And so I think Congress is largely owned by special interests or by donors who may be like nonprofit think tanks but still are special interests. And so, when you give the government too much power, then that power is bought and paid for, and we get the corrupt type of government that we deserve.
And that's a terrific statement. We have literally bought the government we deserve because we've allowed the special interest to steal the republic right from under our eyes. So.
But we made it possible for them to do that because Congress is doing so many things that are unconstitutional. There is nothing in the Constitution that says you can steal from one group of people for the benefit of another group of people, or that Congress can make so many rules and regulations on industry that you can't comply with them unless you have a huge staff of accountants and lawyers, and you really need to have lobbyists to keep your company alive, to try to protect yourself against these regulations, and then, of course, you want to impose them on your potential competitors. So once the government exceeds its constitutional limits and gets too much power, then people do it partly as a means of survival, as well as for just their greed.
Right. You've got a clear understanding of that. I can see why Paul Driessen and the CFAC people hold you in such high regard. You clearly, as a medical doctor, you also understand the fundamental principles that make our republic special, or at least have in the past, and thank goodness there's people in all professions that feel that way. Bukacek is on the line as well as Paul Driessen, and I would like to see if Annie, you've gotten online, and I really want to get your input on. You've had all kinds of issues with government meddling and control in your life, and I'd really like to get your perspective on why government control of the healthcare system is not a good idea.
Well, I wanted to add something to what Dr. Jane Orient said, and that is, there are the special interests, and of course they're running things, but we the people have gotten very used to, very comfortable with accepting the so-called free stuff, and so that's a huge part of the problem. And so there are many people that are highly principled, and they're willing to stand up against this. But when it comes down to it, a huge percentage of we the people like getting the free stuff. They are not going to want to give it up. I mean, even people that consider themselves patriots are still very happy to get their inexpensive medical care that's costing the rest of us. So I think that's something that needs to be addressed. Also, I think that almost always, if not always, when things start going downhill to an extent, it's because we the people have consented to it.
Yeah, that's true. We literally bring our own rope to the hanging, and we've done that for decades. That's why we're in the predicament that we're in.
That's right, and it's all part of the plan, of course. They make it appear, very like it's free, like there isn't any cost to anybody, like it's not going to hurt us down the road. And so the powers that be make it appear that to the people, but the people are real happy to gobble up the free stuff too. So I see that as a huge part of the problem. Is we the people.
Well, Dr. Orient, you talked about the free market aspects of this medical program that the Surgical Center of Oklahoma does, and then the fact that they don't go through Medicaid and Medicare, they go through private insurance or private individuals, and that's how they keep the cost low. Can we do that in all of our medical profession throughout the country? Could we do that and legally be able to get back the quality of health care that we used to have for much less money than we pay for today?
It can be done, and it is being done. Many people are following the example of Surgery Center of Oklahoma. Not enough, but more and more are doing so. Hillary Care would have outlawed private medicine. Obamacare makes it much more difficult. For example, it won't allow physician-owned hospitals to expand. It won't allow more to be established. I think actually many more hospitals could be built and not be burdened with all of these uncompensated costs, like from illegal aliens or just uninsured patients who don't pay their bills, except that the doctors like that free money, as Annie was pointing out, that that they take the Medicare and Medicaid money and they think, we can't possibly survive without it. That this legal plunder that's is built into the system, and it's very, very hard for physicians to turn it down. As one of our members, the late Robert Jaggard, said, when you stick your hand out to take the money, that's when they put the handcuffs on. But the lure of that free money is so seductive that physicians aren't willing to turn it down. And the other thing is that patients don't want to turn it down either. Doctors will say, where I live, nobody will pay me. They expect Medicaid to pay for everything. And so, they can afford meals out, or they can afford a smartphone or so on, but they don't believe that they should have to pay the doctor. That should be somebody else's responsibility.
Yeah, we've got a whole society that believes that somehow the government should take care of everyone and pay for everything, and they don't see the problem with that taking away all their rights as well. As you
That's
say,
right.
you stick your hand out, and that's when the handcuffs go on.
Yes, I'm a council member of the American College of Physicians in the Montana chapter, and we had one of our meetings several years ago at our yearly meeting, and there are 12 of us, and 2 of us were very upset about the extra facility fee that the hospital-owned practices get paid, and the independents like myself don't get paid that facility fee, so I can't afford to see Medicare patients. They get paid double. And so 2 of us were very upset about this because it's basically shutting one of the many mechanisms for shutting down private practice. And in that meeting, we tried to get it to a vote. We gave our arguments and very clearly, very cogently, and the other 10 voted against it. They wanted to keep that facility fee because that's how they get paid.
It's interesting how the idea that everybody should get paid equitably may sound good, but when it comes down to actually doing it, the people who are getting the paid double don't want the other guys to get their fair share.
That's right, and anymore, independent physicians can't make it unless you come up with some other way of doing it, some other creative way of doing it, of taking cash only, or like I have a concierge practice. I mean, honestly, anymore, physicians to just take what insurance pays and the patient's co-pays, you can't afford to keep the lights on. And
that's why more and more doctors are becoming employees, because they just cannot compete with places where you get paid twice as much, depending on the ownership of the facility.
That's correct. And most people don't realize, I do because I'm independent, that honestly, insurance and patient co-pays, seriously, they don't pay enough to keep the lights on. It's not that they don't pay enough for a physician to have some extravagant salary. No, they don't pay enough to just even keep the lights on and have employees. So it's a very, very serious problem.
Well, one of the things that stands out, and this is something that I think we all recognize, is that because of the bureaucracy that is shuffling the paper and setting the prices and doing all the stuff that 50 years ago was just part of the medical practice, and you didn't have all these bureaucrats. But that's at least doubled the cost of health care because of all the bureaucrats. And Dr. Orient, you talked about that early in our discussion, but I think we don't realize just exactly how much cost is associated with just the layering of bureaucrats.
No, and there is a famous chart that shows the increase in the number of bureaucrats. I mean, it's really gone up maybe 10 times, where the number of doctors has gone up twice or something like that. It's a huge discrepancy, but the only way to really demonstrate that that's really true is to go into competition with it and show that the job can be done much better at a fraction of the cost. And we know that's true because Keith Smith and the Surgery Center of Oklahoma and other places now are doing it.
Right. It can be done. There's no question about that. One of the things that I wanted to get to during the discussion is the so-called doping of America, because we've turned into a culture of illegal drugs, and with that, certain pharmaceuticals. I have had as a guest on my show Ann Blake Tracy. I imagine both of you are familiar with Ann, but she has done a study on the opioid problem, and she has done a lot of work with the school systems, and explained on our show how much of the school violence and the gun violence supposedly in schools and stuff can be directly connected with antidepressants and some of the things that are being prescribed to our children. That has really changed over the last 40 or 50 years. I mean, I was one of those kids that in reality today, man, they would have been drugging the daylights out of me because I was very active and very involved and always asking questions, and I was a bit of a troublemaker. They've tried to change the school system to make everybody compliant and everybody to fall in line to their Common Core and so forth. Do you see this as being another one of the medical issues that we need to be dealing with as well?
There was an article in our journal not too long ago, several years ago, by Joel Kaufman, the late Joel Kaufman, who looked at SSRIs, these the most commonly used antidepressant. And there are online surveys of homicides and homicide-suicides, and there are a huge number of perpetrators of these events that are taking these drugs. But we don't really have any good scientific studies. We don't have a denominator. We don't know how many perpetrators there are, and so what percentage of them were taking these drugs. I think certainly something that should always be done when there is such an episode is that the person responsible should be tested for drugs. But there's all kinds of anecdotal reports of people who have taken the drugs and found that it just dramatically changes their personality. One woman, a very calm and rational woman, said she was given an SSRI for migraines, and she threw her computer keyboard through the window. She said, I don't do things like that. I'm not a violent person. I just don't do things like that. And stopping the drug got rid of the problem. So, I mean, I think there probably have been even innocent children in the sense that they never would have been violent. They never would have killed anybody except they were drugged up. And when they were drugged up, they lost impulse control and did horrible, horrible things that ruined their lives as well as all the people around them. And yet, this could have been prevented by just not giving them the drugs.
Right, exactly. I mean, young children, there's a certain amount of our society, they have to realize that kids are kids. And, a rambunctious child, as the old saying goes, the wildest ponies make the best horses. And I really, truly believe that because I was a wild child, but I've certainly turned into a pretty solid adult and a good grandparent and parent. So you can't personality of a young person and expect a positive result. Can you folks hold over for the next hour after the break? And Jane, I know you've got a busy practice there, but could you hold over for just a few minutes and we will try to wrap up your end of the discussion?
Yeah, if we could do a few more minutes.
Okay, thank you.
The Micro Effect. www.themicroeffect.com.
You take the blue pill. The story ends. You wake up in your bed and believe whatever you want to believe. You take the red pill. You stay in Wonderland. And I show you how deep the rabbit hole goes.
There was a mighty nation, blessed above all of creation. It was a rare and precious pearl, conceived in faith and liberty, home of the brave, land of the free. It was the envy of the world. But this shining city on a hill has turned from the Creator's will and let evil take control. Now the reckless men who lead them want to strip away their freedom and to steal their very soul. Now it's smoke and mirrors, switching bait, criticize and confiscate and let the guilty walk away. In this once righteous, godly nation, in the halls of education, they forbid a child to pray. They say we need to spread the wealth, They pretend to guard the health of the feeble and the poor, while the hand they hold behind their back confuses and conceals the fact that the wolf is at the door. There's an unseen hand.
Well, welcome back to Connecting the Dots with Dan Happel, and today we have a special guest on our show, Dr. Jane Orient. And Dr. Orient, I want to give you, I know you've got a busy practice and you need to leave the discussion, but I want to give you an opportunity to tell our listeners what your personal opinion of the future of the medical profession and how we can make a difference in that medical profession by our actions, and how we can help you in that regard.
The medical profession has taken the bait and has gotten dependent on third-party medicine. We have a few independent doctors who are holding out and some who are waking up and are trying to make a go of independent practice. As patients, you need to seek out doctors like that because they are working for you, they are free of conflicts of interest, and they have your benefits at heart, and they likely still believe in the oath of Hippocrates, which is being obliterated from medical schools. And under the oath of Hippocrates, the doctor's not supposed to kill people, he's only supposed to heal them, and he's supposed to treat them according to his best judgment for their benefit. He isn't putting the state or the collective ahead of the benefit of the patient. So I think we have a big problem with the medical professional like with the rest of our society, that we are losing our traditional ethical foundation, and that socialism, along with just being economically destructive, has corrupted our ethics as well. We need to fight against that. We need to shine a light out there to what the truth is. We need to attract people who still believe in that, and we need to help each other out.
I think that's terrific advice, and I have to say, I look forward to next winter when I'm back down in the Tucson area, contacting you. Let's have lunch. I think you have a very clear understanding of what the big problem is, and it looks like I may have found a new doctor for when I'm in the Tucson area. So I thank you again for being our guest on this show, and with that, I hope that you will consider returning when we need more information on what's happening with the medical profession.
Yeah, it's great to talk to you. Thanks for the opportunity.
Thank you so
All
much.
right. Well, thank you very much.
Okay.
Now we've got Paul Driessen and Annie Bukacek on the call. And Annie, you're a special friend, obviously. I've known Annie for, I don't know, quite a few years. I'd say at least 10 years. I remember you being one of the speakers talking about trying to explain what Obamacare wasn't, and why we should fight to make sure that our medical profession didn't fall under the influence of Obamacare, and they didn't pass that legislation. Obviously, we failed in that regard. I was part of that movement as well. But tell our listeners a little bit about some of the problems that you've had in dealing with these federal bureaucrats because of your stance on Obamacare.
Well, it was never proven that they came after me because of my stand on Obamacare. So that was never proven. The investigation did start shortly after I became president of Montana Pro-Life Coalition, and I was speaking out for the unborn at the same time I was speaking against Obamacare. But they never will admit that it has anything to do with that. So I can't prove that, or that it had to do with my praying with patients. So you can never prove that. But it was a very interesting experience, and I've got to go see patients too. So that would almost be a whole other topic. But we got through it, and I'm still practicing medicine the same as I always have, and are getting better all the time even, and still speaking out for the unborn. One thing that I did want to say, and maybe Jane covered it because I came in about 15 minutes late, but when you were talking about the so-called free health care for the illegal aliens, one of the things that I when I was going around, like when I went to Pony, Montana, and other places speaking against Obamacare, one of the things that I warned against was that there's going to be rationing, and because there's only so many resources, and people that need the care the most are going to be rationed because they're the ones that cost the most, and it's happening. It started happening with a fury right after Obamacare passed, and so I wanted to talk a little bit about rationing because most people might not recognize it, but I had one patient. This was shortly after Obamacare passed, and he was bleeding, bright red blood when he went to urinate, and it was painless, but it was frank blood. And oftentimes when it's painless, what we call hematuria, it's often related to cancer of the urinary system. And so we tried to get him in to see a specialist, two of the different groups of urologists here in Kalispell, and couldn't get him in for 2 months, and couldn't get him into Missoula, couldn't get him in anywhere for 2 months. And my staff talked to their staff to try to find out why, and they said it's because he's on Medicare. He's on Medicare. We can't afford to see him. We can't afford to see these patients. So that's a form of rationing. And if my staff hadn't been aggressive in pursuing why this was happening, we wouldn't have known that. So the patients don't realize that when it takes that long, or when they're being denied care, that it's because of rationing, because they'll be given some other song and dance as to why it's happening. And I called one of the specialists here who I like very much, and I said, what is going on here? Why is you've got to see my patient? And he got it in the next day. So it isn't as though they were so busy that they couldn't see him. It's because he was 75 years old and he was on Medicare, and they can't afford to see Medicare patients. So rationing was my biggest concern when I fought against Obamacare, and it is happening. And there are people that are getting denied certain life-saving treatments because they're over 70 or over 72 or over 73 or whatever the arbitrary cutoff is. So that my biggest concern has come true. And then, my second, one of the concerns that I hadn't foreseen, and it's very, very true, is that, like I said, physicians can't be independent. So physicians, as Jane talks about, they're no longer working for the patient, directly for the patient, accountable directly for the patient. They're working for a CEO of a big corporation. They're working for the hospital, or they're working for the VA, or they're working for some large physician group. So there's no longer that working directly for the patient. And the young physicians that are being trained now, they don't know any different. They don't know freedom. They don't know anything other than being a bureaucrat. They don't know what it was like to actually work for the patient, and you and the doctor and the patient actually make the decisions together. They don't know what it's like. All the decisions are made for them. So it's a huge concern, and patient care is going downhill.
Well, and your comments about the rationing are right on. We did talk about that a little bit, but I'm glad you said something about that, because I had a friend who was an English gal who came to the United States because she had ovarian cancer, and the English healthcare system told her that she was going to have to wait 6 months any kind of surgery. So she came to the United States so that she could get surgery, and it literally saved her life. Now, this was 25, 30 years ago. We are trying to adopt the same kind of healthcare system that they have, and it fails there, and it will fail here.
Yeah, it's inevitable, and it's inevitable that people are going to be rationed, and it's inevitable that the care is going to be rationed from the people that need it the most, because they cost the most. And one other thing that I noticed and it's all so subtle, and they sneak it in people. Well, after Obamacare passed, another thing I noticed is whenever we would get a letter about a patient, that was on Medicare, they'd always call them elderly. So they're kind of trying to get it in our mind that, these people that are on Medicare are elderly. They're not worthy somehow of, and it could be somebody 65 years old who still runs marathons or half marathons. It could be, I had an 88-year-old patient who was still a practicing attorney at 88. So they could be a very vibrantly alive, but it's just elderly. So they're and people are buying it. I mean, and they are buying it that the resources should not be used for these older people, even though these older people are the reason we even have had the good system. My parents, for example, they paid into, Medicare. So they worked until they were in their 80s, and they paid into Medicare and Social Security for 50 years. And now we're going to be denying them care. And my own siblings are saying, well, gosh, don't you think the resources could be better used than on mom? And she said that right in front of my mother. So it's just creating this real coldness towards the old people, and just a willingness on the part of the people to look the other way when the elderly are being denied care. And so that's the main. I'm an internal medicine physician, so most of my patients are older, and so that's the part of rationing that I'm seeing is these older people, the senior citizens, are being denied care. It's awful.
Well, I'm glad that you brought that up, Annie, because that's the same attitude about life that also is driving the abortion movement.
That's
and
right.
That is that humans are not special. We are not God's creatures. Most of them are atheists, or certainly not Christian believers, but they are driven by the idea that human life is cheap. And that seems to be a societal norm anymore, and that's also why you fight so hard with your group, Montanans, for the protection of life youth. Are you still there on the line, Annie?
I am. It got cut off. You were talking about the unborn and Montana Pro-Life Coalition, and then you said and then it got cut off.
Oh, okay. Well, I just want to make sure that our listeners realize that there's a real connection here. If they can euthanize the old because they've outlived their usefulness, that's also the same mentality that says we can kill the unborn because they haven't served any purpose yet.
That's right, and it's always been the devil's plan. I mean, for the way for him to take over and develop his world government, there are certain populations of people that are going to have to go by the wayside. He has to degrade humanity. He has to make it such that certain populations will just look the other way when things are happening to other members of the population. So same thing that happened in Nazi Germany, and everybody's so shocked that the German people allowed this to happen. Well, it's happening in our country on a much smaller degree, and people are being groomed. They're being taught to look the other way. These people are not of value because they're Christians, or these are gun owners, or these crazy people that love their Bible. So they're training people. They're turning us against one another and training people, and that's always the devil's plan: to divide and conquer, and just get people to accept that this other percentage of the population, these other type of people, are not of value. Always been the devil's plan.
Mm-hmm. Yes, you're right. And one of the things that always pops out to me is that the same people that express how concerned they are for everyone and fairness and all this stuff are the same ones that are trying to make it impossible for people to have differing opinions, to people to have utilize their First Amendment rights. They feel like we need to be shut up, and we need to be demonized. We need to be people need to be told that we are evil, and that free thought is something that we need to get rid of. And they've done a pretty effective job of selling that.
Yes, they have. Yes, they have, and they're just much better at it than we are. And I don't understand why that is, but it's just the use of language, the talking points, the little, clever phrases like, the Hemlock Society is now called Compassion and Choices, and of course he's had, pro-choice, sounds so wonderful, and women's reproductive freedom. So they have all these little catchphrases that they use and unfortunately, because people don't read anymore, most people don't read, and they just get little sound bites. The sound bites are very, very effective.
Yeah, they are. They're really good at this. Paul Driessen is on the call, and Paul is he's not a medical professional, but he is certainly someone who has been very involved in why the different so-called sciences are really ruining the opportunity for third world countries and for people around the world to participate in the kind of technological development that we have in this country. And that ties into the equation as well. That's part of the whole process. You demonize everyone that disagrees with your point of view, and then you can get away with bloody murder, and that's pretty much what they've been doing. Paul, welcome to the show. I'd love to introduce you personally to Annie Bukacek. She is an absolute fireball, and she is one of the true patriots in Montana. I just adore this lady. She is just absolutely wonderful.
Well, thanks for having me back on the show, Dan, and it's nice to meet you over the air, Annie. I do hope we'll get to meet in person very soon. You know, your comments about abortion and euthanasia do tie in really well with what Dan was just mentioning, the denial of access to affordable energy and access to all the other incredible technologies that have improved, enhanced, and safeguarded us and prolonged our lives, increased our quality of life for such a long period of time in our lives. And it ties in with this cold attitude toward the poor, the elderly, the third world people. Too often we're just pushing these ideas forward. We create government or various activist groups create these problems that really don't even exist except in the media, the activist groups and campaigns, the government campaigns, and eventually the public perception, whether it's global warming or it's overpopulation or it's a host of other topics. And then the government steps in and creates these solutions that A, don't work, B, address a problem that really doesn't exist, and C, creates new problems. But changing things becomes very difficult because A, you're shut down in any debate. You're not allowed to speak up because your views are abhorrent or they hurt snowflake people, or the powers that be simply don't want to hear your perspectives on this. So you end up with bad programs, no accountability for the government bureaucrats or legislators, for the various campaigners, that the activist groups that push so many of these ideas, and no liability or transparency. They operate so much in secrecy. You don't ever get to see the data, the supposed evidence why we have to have these new programs, these new laws, these new solutions to these problems. So it's a very deep-rooted, very problematical issue that we're dealing with on many different fronts, from the energy to the medical to just basic data secrecy all through government. So I'd love to hear some of Annie's thoughts on this, and any thoughts people might have on how we go from where President Trump and EPA Administrator Scott Pruitt and some of the other folks in the administration and Congress are trying to address these major problems that we certainly see here.
Yeah, Annie, would you deal with that maybe and give your opinion on that, because it is all tied together. We all know that.
It is tied together, and it is deeply rooted, so deeply rooted in like I said, we can't even present our own ideas in a public forum. And then it's really hard for people to understand. Unfortunately, I've got a patient I need to go see. I don't want to leave. This is so much fun, but I have a patient that's been waiting for about 20 minutes, so I better get going. But I would love to be on again with you, and I'm so grateful for this opportunity.
Well, thank you, Annie, and I'm glad you could pop on at least for a while, and thank you and bless you for all you do for the medical profession. And we will get you on another time.
Okay, I really appreciate it. Thank you so much. Bye-bye.
All righty. Bye-bye. Okay, Paul, you and I have had so many discussions over the last couple of years about this very thing, and it really is. There's nothing new under the sun, and power corrupts, and absolute power corrupts absolutely. And the bottom line is that the whole thing, everything that's happening in our world today, is a result of a handful of people having way too much power and really wanting to control our entire population and every resource in the world. And your work, your book on, oh boy, I don't have it sitting in front of me right now, but on the eco-imperialism and how the third world countries are the ones that are really being denied the very things that would make their lives more productive and more healthy, more healthful, and make their countries, turn their countries really into something special in itself. And that is directly out of eco-environmental movement. And they are denying things to those countries that we've enjoyed and that have made our nation very, very developed and very prosperous. Do you want to go into a little bit of detail on that?
Absolutely. Thanks for the opportunity. And keep in mind, it's not just the third world, the poor, underdeveloped countries. A lot of this is impacting us right here in the United States and Europe, Canada, Australia, and so forth, especially if we're looking at the energy issues. What you see being pushed forward in the industrialized nations is the idea that we should be shutting down coal and natural gas-fired power plants because you have to stop global warming and climate change. When you look out there, you don't really see actual evidence that any of this is changing or that we're seeing kinds of weather and other events that we didn't see for the past hundreds of years. But the computer models and the assertions, the hype, the hysteria all dramatize this changing world that they envision in their computer models and their press releases. And therefore, we need to have major power and control over our energy and other natural resource use. The net result is that we are shifting more and more to unreliable wind and solar power and electricity prices that are going higher and higher. For example, if you're in certain states, and you can look at them, whether they're Ohio or the Dakotas and so forth, you're paying 8, 9, 10 cents a kilowatt hour. But in Connecticut, Massachusetts, New York, California, you're paying about 18 cents a kilowatt hour for your electricity, so almost double. And then if you go over to Germany and Denmark, they're paying 45 cents a kilowatt hour. So they're paying 4 times as much as we're paying in a lot of U.S. states, maybe even 5 times. That has a huge impact, not just on industries and businesses, but on poor families, on pensioners, the elderly, people in England, in the elderly communities can't afford to heat their homes properly, and this is really the case throughout Europe during the winter time, and thousands of people die each year as a result of those prices. They can't heat their homes properly, and they die eventually of hypothermia and related diseases. Then you get into the developing countries in Africa, for example, and the World Bank and the EU, the European Union, are telling those people they cannot build a coal-fired or even natural gas-fired power plant because the EU and World Bank are worried about global warming and climate change. The people in these countries are saying, look, 90% of our population in sub-Saharan Africa still does not have electricity for anything, or they have it a couple hours a week at very unpredictable times. And their people are dying right now from readily preventable diseases that increased prosperity and health care would eliminate. But you've got a lot of these same environmentalists that say, well, we got too many people in the world, and banning electricity and modern development population down a little bit by causing a lot of people to die off before they're 5 years old even. So this is kind of the scope and nature of this entire environmental movement that we're dealing with today that has gotten so obscenely rich and powerful. It's so focused on imaginary problems, but they have a utopia in mind that they're going to impose on the world with far fewer people, and it's not going to be them and their kids that are going to die to make the world have far fewer people. It's somebody else's kids.
Right, right. And that's exactly what this is all about. The idea is that they want to control everything, and in the process, the medical aspects of this are huge because, they've talked about, Rachel Carson's Silent Spring ended the use of DDT in many countries, certainly in the United States, but in many countries around the world. And DDT was the number one pesticide that got rid of malaria-carrying mosquitoes. And as a result of that, millions of people have died from malaria unnecessarily. And in truth, DDT didn't cause the problem that they claimed it did. It may have had some effects on the environment, but certainly the amount of life that was lost in comparison to how much good it did for the environment, it's obvious that there was a political, really a political meaning behind all this.
Well, that's absolutely right. When you're looking at DDT, for example, I'm glad you brought that up. We did use DDT tremendously widespread use of DDT in the United States. Probably a lot more than was necessary, but it never caused the cancer and other environmental problems that the environmental groups claim it did. It didn't thin eggshells for birds. What the studies that were done on eggshell thinning were giving the birds diets that were tremendously 90% deficient in calcium, and that's why their eggshells were thin. Once they gave the birds the proper diet, there was no effect from DDT. DDT has never been shown to cause cancer.
Paul, we're going to have to stop for the break here, but if you would pick that thought up on the other side, we'll continue that discussion.
This is The Micro Effect. The Micro Effect. www.themicroeffect.com.
Well, welcome back to Connecting the Dots with Dan Happel. And today my guest for the last half hour of this program is Paul Driessen. Paul is a very talented, very gifted writer and someone who has been a great contributor to CFACT and to Heartland Institute and a number of other very let's say, property rights and liberty-oriented organizations. And Paul, I thank you for coming back on our radio show. I had our earlier discussion was with Dr. Jane Orient and with Dr. Annie Bukacek. And one of the discussions as we were leaving was the fact that DDT and some of these other things really had quite an impact on life on Earth, and for very nefarious reasons, because the reality is the environmental movement really could not prove that these chemicals were bad for the environment, certainly not compared to the amount of lives that they saved. And I want to start this last half-hour discussion by saying, and I'll use a statement without really any reservation on my part, these environmental policies are inherently racist, and they are being conducted by people who claim that the libertarians and the Republicans in our country are the racists, when in fact it looks to me like the other side are the racists, because they are destroying opportunities to improve the lives of many minorities around the world. So let's get into it with that discussion, Paul.
Well, absolutely, you're right on that. And by the way, I've also been very involved in civil rights programs through the Congress of Racial Equality, where I've been involved for many years. But one of the attitudes of a lot of these people, the hardcore environmentalists, is that humans just are not special. They're not God's creatures. They're no better or different than more valuable than animals. Ingrid Newkirk, the head of People for the Ethical Treatment of Animals, has said on several occasions that a rat is a dog, is a pig, is a boy, is a bug. They're all the same. No species has better claim to being alive than any other, and I find that pretty reprehensible. But if you go back to the DDT issue, this is a very good example of this. DDT was the chemical that finally put an end to malaria and yellow fever here in the United States. It was what put an end finally to those diseases in Europe. And yes, these diseases were found way up into northern Europe. They were found even in Siberia. Malaria was a massive killer in Siberia, and DDT finally got rid of it. The environmentalists, led by Environmental Defense Fund, wanted a campaign, a topic that would put them on the map and give them power like they had never seen before. DDT was what they chose, and they could do this because we no longer had malaria here in the United States. So they launched a campaign. The first EPA secretary or administrator was William Ruckelshaus. He convened a scientific committee that looked at all the charges against DDT, that it caused all kinds of health problems, including cancer, that it poisoned animals and other wildlife. The committee of top scientists from the United States concluded, after months of hearings, that all these claims against DDT were false, that there was no truth to any of them, that the science did not back up any of them. And Ruckelshaus never attended one meeting, 1 minute of those meetings, never read one page of the thousands of pages they put together for this committee report. He simply said, I have a political problem, and I'm going to solve it by banning DDT. The repercussions were felt worldwide, and DDT was basically taken off the market worldwide, even for medical purposes, even to prevent diseases. Now, today, DDT is not a great pesticide compared to what we have, but what DDT does is serves as the longest-lasting, most powerful insect repellent that's ever been developed. Nothing comes close. You spray the walls of a home in Africa once or twice a year, and it keeps 80% of the mosquitoes from even entering. Any that come in get irritated, and they don't bite. If they land on the wall, they die. So you dramatically reduce the amount of malaria that you have to deal with in the first place, and that makes the drugs much more effective because they can reach more people. So by denying the populations of Uganda and Kenya and other African countries access to DDT, these environmentalists have been killing literally millions and millions of people, especially pregnant women and crime against humanity in my view, and as Dan just said, as you just said, Dan, it's a racist policy. You would never get away with imposing these kinds of death tolls on white Americans or Europeans. But it's easy for the environmentalists, it seems, to impose those death tolls and disease tolls on Africans and Asians and Latin Americans.
Yeah, you're right. And Paul, I have to ask you to check your connection on your phone and try to speak up a little bit if you could, because we're having some audio issues.
Okay, I will do that. I didn't realize that. My apologies.
Well, I should have said something a little sooner. But let's continue with this discussion, because it's really important, I think, that people understand that what has happened in so much of the world by the do-gooders, why in the world do they get away with this stuff? I mean, they will, on the one hand, talk about how they love the different minority groups or the different people around the world, and how we need to march in lockstep and work together and all this stuff. And at the same time, when there's an excellent opportunity to protect life in third world countries, they refuse to do it.
Yeah, it's a mystery to me as well that you have these groups that are rolling in money, $13 billion a year environmental activist industry, and they create these issues, dramatize them, pound on them incessantly because they have the money and the media access and the political power to do so. And in the process, they're denying people around the world access to the kinds of technologies that we take for granted here in the United States. I mean, just something as simple as electricity. And around the world, 1.5 billion people still don't have electricity. More people than live in Canada, the United States, and Mexico combined in sub-Saharan Africa don't have electricity at all, or get it a few hours unpredictably every week. And I can't even imagine my life without electricity. When you look around you and you see everything that is made possible by electricity, the notion that you can't have it, or you should have only what you can get from a little solar panel on your hut or a couple of wind turbines around your village, and you get it sporadically, unpredictably, grossly insufficient amounts at such high prices that you couldn't afford to run any kind of operation, even if you had the electricity coming in from these technologies. To deny modern, affordable, coal-based, natural gas-fired, nuclear power, even hydroelectric power to people in Africa is, to me, unconscionable. And yet the environmentalists work constantly to do that, to prevent coal-fired and gas-fired power plants from being built. Of course, they despise nuclear, and they don't even want hydroelectric projects built in these countries. From their perspective, if you can just give these people a little solar panel on their hut, maybe a solar-powered oven, a couple of wind turbines, that should be enough. It'll improve their lives a little bit, but not too much. You don't want to turn any of these people into middle-class consumers, because then they would use more energy and they would use up more of the world's resources, and that would be bad for the planet. But just imagine any of those people voluntarily slashing their own energy use to the African levels or Indian levels. It just isn't going to happen. So it's a massive, unconscionable double standard that I do find racist and eco-imperialistic.
Absolutely. Well, your book is extremely well-informed reading for people that really want to learn more about this subject. Now, I know that one of the biggest single health issues in Africa is people burning cow dung and different anything they can find to heat or cook food. And as a result of being in these closed-in huts that have all respiratory problems as a result of burning this material. Obviously, that is unforgivable if they could change all that with just a little electricity.
Yeah, absolutely. They're dying not just from the lung infections that are preventable if they had access to regular electricity and modern fuels of other kinds, but they also die from intestinal diseases that are brought on by having no access to clean water. Again, electricity plays a major role in that. No refrigeration to keep food from spoiling and becoming bacteria-laden. Again, lack of electricity. So you're absolutely right. And what you're seeing is a massive death toll plus tremendous poverty and misery, malnutrition, and illnesses that are readily preventable if you could just modernize their societies. To me, it's bad enough that so many of them have to deal with corrupt, kleptocratic, lying governments and political leaders who are only in it for themselves, but then to have this modern environmental movement making their lives as miserable as possible by working overtime, pressuring the World Bank and the EU and all kinds of other organizations not to finance or build power plants in these countries. To me, it's just unconscionable.
Yeah, it is. And the other thing that I find really unconscionable is the fact that hydroelectric power, which to me is obviously the solution to so many power generation issues in Africa and places like that. Hydroelectric would perform miracles, and yet hydroelectric is completely off the table. Damming rivers for irrigation projects or for electrical generation is completely off the table for the environmentalists. Why?
Yeah, you get these river rafter groups that want to fly over to Africa so they can go river rafting on the some of the rivers like the Nile and some parts of the Nile that are very fast moving, other rivers around Africa and Latin America and so forth. And they want to be able to enjoy their vacations and go river rafting, but they fly there in airplanes using jet fuel and emitting greenhouse gases, and then tell these people that they should dam up a river in order to have hydroelectric power. And then the next thing they say is, well, you can't have nuclear power because nuclear is just bad, it's dangerous, and you can't have coal and natural gas because of greenhouse gases. But of course, burning wood and animal dung and grass emits far more carbon dioxide and other gases per unit of energy than natural gas or coal does. So the double standards again and the hypocrisy involved here, combined with their callous attitudes toward these people in these countries, is just unbelievable. I just cannot understand it. There is no rhyme or reason for it. And by shutting us down on the other side of the political spectrum, they pretty much close off debate on college campuses and elsewhere on these topics. You're not allowed to bring these other points up. And not only do they poison and propagandize young minds, but they prevent them from hearing the counter-arguments and these humanitarian arguments. All you hear are the phony environmental claims about global warming or something else, some other global disaster that exists in computer models, when the real human disasters are occurring on a daily basis because of these environmental policies.
Right. And one of the things that really comes out of all this is that double standard is pretty much for the developing world, and at the same time we are having a problem in our own country where we're deindustrializing our own country and moving a lot of our industry and a lot of our opportunities overseas to third world countries that have no regulation on their environmental pollution. I don't understand how the environmental groups can justify that kind of a double standard as well.
Well, that's absolutely right. What they're doing is sending a lot of our industries over to China and India, which are building power plants by the hundreds or the thousands. China alone is financing almost 1,000 coal-fired power plants around the world outside of China. And so the amount of carbon dioxide going into the air is increasing every year. And of course, carbon dioxide makes plants grow better, so I don't see that as a problem. But what they're claiming is that carbon dioxide has replaced solar power and all the other natural forces that were powerful enough to create ice ages and make them come and go 5 different times. But all of a sudden, carbon dioxide has replaced the sun and all those powerful natural forces that used to operate. It's just insane from every perspective. And here in the United States, the Obama-era war on coal has shut down a lot of the coal-fired power plants. It's driven up a lot of electricity prices. It's destroyed a lot of lives, and it brought on a lot of suicides in many communities that suffered from unemployment and a lot of diseases related to unemployment and just a lack of hope, a lack of belief that they and their kids had a future. So you see all sorts of problems, repercussions from these environmentalist policies that have no basis in scientific fact or real-world evidence.
Yeah, and the other part of that, besides the scientific fact, I see this as being a free pass for communist or socialist countries, and that our system of free enterprise is really what they're targeting, because they wouldn't otherwise let these other countries pollute almost without any repercussions whatsoever, but target us. And we are the cleanest in Western Europe, are the cleanest the cleanest countries in the world, because we've figured out how to reduce the pollution, not the CO2, but the pollution that's inherent with industrial economies. And they haven't done that in other countries in the world.
Yeah, that's another excellent point. And that brings up what a couple of the leaders of the United Nations Intergovernmental Panel on Climate Change, the ones that are driving the Paris Treaty on Climate Change and all these other climate programs, the 2 of their top people had this to say. One of them said that what they have taken on through climate change and other environmental programs is the important task of eliminating capitalism and replacing it with an environment-centered kind of socialism at a United Nations global level. Another person said that climate change has nothing to do anymore with the environment. It's really focused on how the world's wealth is going to be redistributed. So those are the things that are actually driving this, a lot of power and control over our lives, our living standards, our livelihoods, and our liberties, with no opportunity to debate. And once these programs are implemented, no accountability for the people that imposed these policies or for the harm that they've inflicted on us, either because of their stupidity or greed or very deliberately in many cases. None of them gets to suffer the consequences of their own actions, and in fact they end up living better than the rest of us because they're the ones in the positions of power, they and their friends that keep them in power. So whether it's communism or socialism or modern environmentalism, whatever terminology you use, it represents standards and our lifespans even.
Yep. Yep, you're right, Paul.
Going,
and I want to mention that the one of the things that I know you and I have talked about previously, and I'd like to have this open challenge. We really would like to see an open and public debate at the university levels throughout this country. And your group, CFACT, and the Heartland Institute, there's a number of people who would be more than happy to take that challenge to the so-called radical environmentalists, the people who believe that man is destroying the environment. Tell our listeners, well, there was one instance where that actually happened. That was at Columbia University, and I believe it was around 2010. And tell our listeners how that debate ended up.
Well, this was a debate that actually involved Michael Crichton, who is not just a film producer and novelist. He was a PhD biologist and physician by training, so he really knew his science. And there was a debate on climate change and whether it was really man-made or not, and whether it was really happening or not. Michael Crichton was not a believer in the man-made climate crisis perspective, and his side started out before the debate. Only 40% of the audience supported his perspective. After the debate, 60% of the audience supported his perspective. So they changed a lot of minds just within an hour and a half. This is symptomatic of what's been going on. The other side does not want to have a debate because we have the facts and the human rights arguments on our side, and they don't want those brought out. They know they would lose any of these debates. That's why they want to silence us on campuses. It's why they don't want to debate us in an open forum, and it's why radio shows like yours are so important for getting the facts out.
Well, thank you, Paul. And we're getting toward the end of the radio program here today. I want to thank you for being our guest. Would you like to tell our listeners a little bit more about some of your writing and ways that they can get your books?
Yeah, my books are available through Amazon.com and Barnes & Noble and elsewhere. My articles are up on townhall.com. As a columnist, they're available on cfact.org, cfact.org. They're available oftentimes through Heartland Institute in Chicago. So not just I, but a lot of other folks out there, like Competitive Enterprise Institute, are doing our best to get the facts out to people. And you're doing yeoman's work in this regard as well. I appreciate very much the opportunity to be on your show.
Well, thank you, Paul. And folks, make sure that you listen to Debbie Boscalupi's Radioactive Wednesday tomorrow, starting at 9 a.m. Mountain Time. Thank you, Paul.
Thank you, Dan.
Now you can feel that squeaky clean sensation like none other.